Just bear with me. I'm going to flip between a screen real quick. We're here today for the full partner meeting of the First 1000 Days Initiative, and to thank our partners, new and old, for their excitement and their passion about this network. Our accomplishments would not be possible without the Barancik Foundation spearheading this initiative. And a big, big thank you to many other donors, including Gulf Coast, Sarasota Memorial, Selby Foundation, the Elsa and Peter Soderberg Foundation, Philanzer Trust, and many, many other individual donors. And just as a reminder of why we're here, First 1000 Days is critical in a child's development for their well-being and mental health. And as most of us know on the call, what happens during a child's early years really impacts them for the rest of their lives. And one person we like to quote often is Terry Hansen, who says, the earlier the investment, the greater the return on a child. That is very true. By supporting families early on, we work to reduce ongoing cycles of poverty, trauma, and systemic health inequities. Just for a little bit of history, Sarasota County stakeholders.
On your laptop? No.
You guys could put yourself on mute. That would be helpful. Okay. A little history here. In 2018, we started this process with 32 partner organizations in an effort to improve and support families and babies. And since that time, the initiative has grown tremendously into a no wrong door approach in the surrounding 4 counties and with over 90 regional agencies. We're preparing to share our first 3-year report with our partners in the upcoming weeks. That's very exciting. And we invite you to visit our website to learn more about our focus. Today's focus, First 1000 Days has 5 key components to drive its vision: integrative activities, care coordination, parent empowerment, partner collaboration and innovation, and targeted interventions and services. Our meeting today will focus on the one piece of care coordination. We know that navigating the system can be difficult, and it's listed as one of the top barriers identified by professionals and families in the community in accessing care. There are obstacles such as keeping directories up to date, sending referrals can become time consuming and taxing. There was no closed loop system to inform families getting connected, and then the agencies doing the work actually doing the work and being able to demonstrate that those services were completed. A lack of community data on capacity concerns, barriers, and service gaps, and limited screening for social determinants and mental health needs. First 1000 Days leaders selected the Unite Us platform for our local community to address those concerns. And today we're going to share with you the impact that investment has provided for our community. To kick off our meeting, Kim Kutch and Michelle Gaines are going to share about a critical program that was developed in collaboration with First 1000 Days on the Unite Us platform to improve access to care and support for substance abuse newborns and their families. We will then hear from Mary O'Connor and Dr. Washington Hill on Sarasota Memorial Social Determinants of Health Screening Program, and ending with a presentation today from Unite Us on our local impacts. To get us all thinking before we start, I want to leave you with this image. Imagine if all our agencies were screening and referring for SDOH needs. Imagine if a family could be helped with multiple needs by just going to one location. And imagine if there truly was no wrong door for parents to get help that they needed. Imagine if we had the data to know what services are missing in our community and work proactively with government and philanthropic agencies to address them. Imagine if we could provide every family the comprehensive, compassionate, and equitable care they deserve. Okay, with that, I'm going to turn this over to Kim and Michelle.
Hi, good morning, everyone. I'm Kim Kutch with the Department of Children and Families. And just to get this started, we had some changes in federal legislation through the Child Abuse Prevention and Treatment Act and the Comprehensive Addiction and Recovery Act, where they removed the term illegal as it applied to substance abuse affecting infants, and they required plans of safe care to address the needs of both infants and their families. They also required data collection and monitoring. So states had to develop policies and procedures to include appropriate referrals to child protection service systems and others to address the needs of the infants born and identified in being affected by substance abuse or withdrawal symptoms resulting from prenatal drug exposure or fetal alcohol spectrum disorder. And with that, they also required physicians or healthcare providers to be able to make those plans of referrals to plan and safe care along with assessments. And so whenever we got started here in Circuit 12 to start developing the plan of safe care, we worked through Dr. Hill's ASAP group to find the right group of people to start that plan and develop it. And through the first 1,000 days, we were able to do that. And then the Sarasota YMCA received the CAPTA grant to actually put that plan of safe care into place. So I can turn it over to Michelle so she can talk about the actual plan of safe care.
Hi, good morning. Yeah, SCC launched, we began to house the plan of safe care in July of 2021. We're currently about 10 months into that. So what we are really focusing on is reducing the number of substance exposed births, reducing the number of child removals, and increasing child family well-being. And we do this through the plan of safe care. The plan of safe care is a preventative approach to reaching pregnant women who are substance using, new mothers who are substance using, or meeting them at postpartum when there is a substance exposed infant. But we want to focus our attention on pregnant women and meeting them at the earliest point of misuse. This could either be by a drug screen that was positive, or it was through an interview where mom admitted she was substance using. Once we have identified a parent who is substance misusing, we develop that plan of safe care and connect them to services in that coordination of care. We're a voluntary program. We meet with families on a weekly basis, and we go to the home and we provide that one-on-one interaction to really identify needs and connect them to services. The goal of the plan of safe care is to ensure that mom and baby are both healthy and safe during pregnancy and postpartum. So we begin to link them to different services to address their substance misuse. We have master level and licensed therapists who work with mom to develop that plan and identify needs. They also provide supportive counseling and psychoeducation. We also provide a parenting approach. And then we also have a nurse who provides that medical support. So what we've learned in our earliest stage in our own development of our program is that when we're able to meet a mom at the earliest point, we can go ahead and develop that plan, start connecting them to services, and hopefully reduce that impact of substance misuse. Because maybe she's under medical care, maybe she's in treatment, and she's receiving counseling and attending groups, testing negative on drug screens. So at the time of delivery, when she goes into the hospital, she can go in with her plan, and she can also be in a state where that child could be born not exposed or withdrawing from symptoms. We also, once we have developed that plan, we place it on the Unitas platform. Different agencies can access the plan, who have access to the plan of safe care and follow the mom's progress or baby's progress. They can also continue to update the plan and kind of give us a real-time scenario of how that family is doing as they move through different agencies for assisted care. Since we've launched our program, we have been able to complete in the month of March 20 plans. Overall, since July of last year, we've completed 128 plans of safe care. We've provided 60 home visits in the past month and 351 home visits since July of last year. We currently have 60 families that we are serving across the circuit. We're serving Sarasota, DeSoto, and Manatee. And that's kind of a quick wraparound of what we're trying to do. Our goal is really to get with moms at the earliest point and connect them to services.
Great. Does anybody have any questions? And I'm trying to monitor the chat as well. Anybody quick questions that want to come off mute and just shout it out? Go ahead. If not, I'm going to move to the next agenda item, which I think I went backwards here. We need to allow Tina and Sienna 5 minutes to update the Plant Grow Bloom initiative. Thank you, Michelle and Kim.
Cameron, before we move to the next piece, I just really want to commend Save Children Coalition. For those of you who don't know me on the call, my name is Chelsea Arnold and I'm the manager of First 1000 Days Suncoast. It's been really wonderful to be able to collaborate with Michelle and her team. And I want to thank so many of you who are on this call who helped us develop the plan of safe care and put it on the Unite Us platform. And a quick call to action. We know that there are pregnant individuals out there who need this kind of support. And we really, really urge you to connect them with Save Children Coalition. Oftentimes they go places where they trust individuals, where they feel that connection. And we hope that you can use that connection that you have with your clients to get them the help that they need through Save Children Coalition Plan of Safe Care. And it is on the Unite Us platform, as Michelle mentioned. So we urge you to use Unite Us as the platform to send referrals over to Save Children Coalition. And again, it's really to prevent that retelling of their story, the re-traumatization of them having to live their stories over and over again. If we all work collaboratively together, we can make sure that they're getting the care that they need. Kim was instrumental in developing the plan of safe care, so we really appreciate her. And we look forward to continuing to help families in our community. And for time's sake, we're gonna move on to the next piece. And we're gonna go ahead and introduce Mary O'Connor with Sarasota Memorial Healthcare System. She is the manager of community outreach. And Dr. Washington Hill, he's involved in so many things, I can't possibly list them all, but he is a maternal fetal medicine doctor and he is a OBGYN at Center Place Health. He's been instrumental in many of the initiatives, endeavors, and same with Mary. We really appreciate them sharing really that no wrong door approach to care beginning during pregnancy. Thank you so much.
Yeah.
Thank you. Can you hear me?
We
Yes.
can hear you.
Can you see me?
Yes.
Well, good morning, everyone. I hope everyone had a blessed Easter yesterday. It was certainly a beautiful day at Siesta Key. My team and I, Mary O'Connor and myself, have been asked to talk about the social determinants of health, and Mary will give a practical application of what I'm going to show you in a second or two. We have no disclosures. Our objectives are shown here to define the social determinants of health. They've already been mentioned several times. So what is SDOH? What does it mean? We're going to define how the social determinants of health are being addressed within the Sarasota Memorial Women and Children's Services, and certainly this initiative and in our community. And then we're going to explain how employing strategies to address the social determinants of health can help patients, clients obtain better medical, social, and behavioral health care. And that's what we've been all about. Mary and I thought we would start with a case, a 55-year-old unemployed father who has been hospitalized for congestive heart failure for the 3rd time in 6 months, is being discharged. Insurance is Medicaid, housing is okay, but crowded. Several generations live in the house, gets and takes meds from time to time, has no primary care provider. While hospitalized, his 22-year-old, 15-week pregnant daughter presented overdose in the SMH OB ECC, that's our emergency room, with no prenatal care. So what are and might be the social determinants or drivers of health that could be addressed in this family? And more importantly, how do we do it? So the first question is, how did the social determinants of health develop? No, they weren't developed or come down from on high from the government or from CDC. And this sentence says it all. David Satcher is a colleague of mine who was previously the Surgeon General. And David would say, and others would say, institutional, intrapersonal, interpersonal, systemic, structural, and economic racism played and play a major role in the development of the political and social determinants of health, resulting in poor health outcomes and health disparities, regardless of our specialty, whether it's OBGYN or orthopedics or whatever. It's a long sentence. I'd ask you to come back to it from time to time. We're going to try to dissect it a little bit. So what is racism? We've heard a lot about racism. We hear about it on the news. Individual racism is a personal belief in the superiority of one's race over another. We've all heard that definition. Black over white, white over black, white over Asian, etc. It's linked to racial prejudice and discriminatory behavior, which can be an expression of implicit, you have it, you don't outwardly show it, but it's down in your mind. It's the way you were brought up. And explicit bias, which is pretty clear. Institutional racism is a system of assigning value and allocating opportunities based on skin color. There actually is now a talk of a theory called colorism. Unfairly privileges some individuals and groups over others and influences social institutions in our medical and other systems. Certainly that is true. So what are we to do? If you remember nothing else from what I'm going to say, please remember this. It's not original, but it's true. If we do not understand racism, if we are not willing to accept that there is such a thing and its many forms, and are not willing to address it, we will never eliminate health disparities. It won't happen because all and both are clearly related. So what are the political determinants of health? We mentioned that earlier. It involved the systematic process of structuring relationships, distributing resources, and administering power. The political determinants of health and the social determinants of health, both simultaneously in ways that mutually reinforce or influence one another, shape opportunities that either advance health equity or exacerbate health inequity. And you can all think of that. You know how our government, whether the government is local or in Tallahassee or in Washington, can affect the social determinants of health and the way we deal with them. My colleague Kim would say an amen to that. The political determinants of health contribute to early death, disability, and poor health outcomes. They are the instigators of the causes of health inequities and the determinants of the determinants. I'll give you an example of a political determinant of health. A patient has no insurance, goes to the computer and gets Medicaid, and she is assigned a Medicaid program. That's the good news. The bad news is the providers that she needs are not on the program in the city where she lives. Isn't there a connection there between the political determinants of health and the social determinants of health? And these are some of the political determinants of health. Voting. On the front page today of the Tampa News and our own news was the whole issue of redistricting and voting. And the reason that is so important is because it's a political determinant of health. Government and barriers, policy, and as I already mentioned, the insurance issue. So what are the social determinants of health, the SDOH that we've mentioned? Conditions in the environment where people are born, live, learn, love, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes or risks. And you can probably add to that long list. Who you love should not affect your healthcare. Duh. So the major impact on people's health, well-being, and quality of life are shown here. Safe housing, racism, education, access to nutritious foods. Every time we have the DOH call, we talk about food deserts, polluted air and health, and of course, language. And the social determinants of health can be grouped into 5 domains. I've already touched on this. Economic. It's hard to be healthy if you're poor. Education, healthcare access, the neighborhood in which you live, and the community. That is why this hospital is very good within the walls. But with what you and others have been trying to do, and I know Pam is on the call, and I know Mary's right behind me, is to get out into the community. This slide is available, as all of them are, and it actually was put together by a nurse working on her doctorate. And she asked, what are the factors that contribute, to health, our health, healthcare inequities, she worked in a hospital, and disparities. We all know what disparities mean. The maternal deaths in Black women are 3 times higher than the maternal deaths in white women. There's a problem there. And we are about the business, all of us, of trying to dissect what that problem is and to decrease that 3 times higher. And these are the factors that this nurse came up with, Nurse Kilborn. Health system factors. Is our health system culture positive to seeing everyone and reducing health disparities? Patient level factors. Are patients satisfied? And on the other side of the coin, do their beliefs and hesitancy, right, affect their healthcare? Clinical encounters. Are we not humble? And do we try to put ourselves, all of us, in the seats and the chairs and the body of the patients we see? Provider factors, knowledge, and attitudes. There was a very interesting study done that showed that when a Black patient was being taken care of by a Black nurse and provider, best practices were more likely adhered to. And when it was discordant, they were not. A colleague here who's working on her doctor said, we all know the best practices, we need to use them. And then we already touched on the social determinants of health, poverty, unemployment, stability, food security, and racism. So you can see how all of these are interrelated. Take some time and look at it. This, without question, is my favorite slide. You've all seen it. I know Kelly's on the call. She's seen it. One time someone asked me, where'd you get it? So I put the source as unknown because we don't know where this came from, but we know what it means. And in this instance, we're talking about healthcare needed to decrease disparities. That's what you all are all about. And we look at equality. If we said that you couldn't get healthcare because of whatever, your color or where you lived, or because I didn't like you, none of us would say that's acceptable. So equality is important. And we have to recognize that the social determinants of health and the political determinants of health do affect whether or not we get that care. Whether you're rich or whether you're poor, you'll need some help. Because you call me and other people up and ask a question. And you can see that some can't get the apple, regardless of how hard they try, because of racism or where they live or whatever, the social determinant, they cannot get a piece of the apple. And what you and I and others are all about, we and Marjorie and Chuck, we are the ones who add those boxes so that everyone can get a piece of the apple. It's not easy, but that's what we do. And here at the hospital, and this is the last slide, we've come a long ways. We have a diversity committee. We have formed, the chairs of the committee are myself and Lori Bennett, who's in charge of HR, and Charles Henson in charge of organization training. And you can see that we broke out into education. Everybody has to look at an educational video, and I think we're on number 1 now and moving on to 2 and 3. Awareness, Dr. Day is one of the chairs there, and we're going to be doing some research, community prevention. We have to get outside of our hospital. And Sarah Temple and certainly Pam and Mary O help us there. We look at the social determinants of health with Dr. Visa Ramesh and Dave Goodman. And then I and others are involved in a diverse workforce. Clearly, if a patient is taken care of by someone who looks like them, they do better. So this is the social determinants of health. And much of this you've heard before. I would tell you that we just need to continue to do what we're doing. And as people have come up to me and I've said, it ain't easy. It takes a lot of energy, it takes a lot of work, and I thank you for doing that.
Dr. Hill, I want to thank you for being transparent about this with what the hospital's doing. It's really, really inspiring, and I hope it is good fodder for other individuals on the call today to think about their own organizations and efforts in DEI.
Thank you very much. All right.
Good morning, everybody. My name is Mary O'Connor, as Dr. Hill mentioned. I am the manager of community outreach and education for the Women's and Children's Division here at Sarasota Memorial. I've got just a little bit about me. I've been working here since 2000, the year 2000, so 22 years this year. I have a bachelor's degree in biology from New College here in town. I've got a bachelor's degree also in nursing from USF, and a master's degree in nursing from Florida State University. I got a certification in trauma and resilience, as well as Six Sigma Green Belt certification. So enough about me, let's crack on. And so the question is, what is the problem around here anyway? And I can tell you the first 1,000 days is starting to figure it out. One of the earliest and most important things the initiative did was to conduct a broad needs assessment of families, as well as social service and behavioral health agencies in the community. The results of the families assessment show that one of the biggest barriers to care was that they had difficulty navigating the system. And I know from personal experience, and I'm sure that many of you know, that the health and social service system is seriously complicated, even for the most well-connected of us, never mind for a family who's already struggling for basic needs. Additionally, the assessment revealed that agencies really felt the same. They found it difficult to keep up to date on other agencies' programs and eligibility, so it became challenging for them to effectively refer clients to appropriate services. Also, in general, it's difficult for agencies themselves to keep up on their own marketing collateral. And so getting the word out to families and other agencies about their own services really proves difficult. And I know that here at SMH as well. This all contributed to agencies being siloed from each other. The assessment also found that there was no up-to-date resource guide for the whole system. Though many agencies spent time creating resource guides for their staff, those resource guides required constant energy to keep them updated. And so they're practically outdated as soon as they're printed. And another big issue that was identified in that needs assessment was that while every agency in the system was keeping up with their own data as best they could, there was no data to inform the whole system of care. So essentially, the data was siloed as well. So in a nutshell, from a systems view, while every agency was keeping their head down, working hard in order to stay operable, they were all essentially working unintentionally in silos. And it's obvious that there was a huge need for systems change. So this is the conceptualization of the complicated maze of resources that families have to navigate. Seriously, it's giving me a headache just looking at it. We can see the pregnant woman over here on the left-hand side of the slide having to navigate that maze. She's got a big headache hanging out there right in front of her as well. So it's the mission of the first 1,000 days Suncoast Initiative to improve the navigability of the system. And then look here on the right-hand side of the slide. Could we dare to wish that the system of care could be smooth and linear like this for families? Our collective vision is for there to be no wrong door for families in our region. Could we dare here to wish to see a system of care like this? If only we could work as one more coordinated, efficient system with other agencies, families would be better connected to services and would be less likely to fall through the cracks. Well, I'm here to tell you that wishes do come true, and we've got ours in the form of Unite Us. Unite Us is an outcome-focused technology company that builds coordinated care networks of health and social service providers. They connect providers around their clients, just like in this photo, in a centralized platform integrating social determinants of health into collaborative care delivery. Now, through the work of the first 1,000 days, the Unite Us platform was discovered and evaluated. Through the generous donors of the first 1,000 days, the financing was secured for the purchase of the platform. The SMH legal team approved and signed the contract with Unite Us, and the SMH IT team vetted it. The Unite Us platform literally ticks all the boxes. It provides electronic referrals between agencies, so case managers don't have to stand at the fax machine or wait on phone calls any longer. Importantly, it's HIPAA compliant. It's also a closed loop system, meaning the sender of the referral receives notification that the referral was accepted or rejected in any case. Here's a quote from Donna Love, a volunteer at Mothers Helping Mothers. that use Unite Us and demonstrates how important this closed system loop is to caseworkers. So quote, "Last Friday, I worked with a client with pressing medical needs who had lost her job and health insurance because of COVID. She wasn't asking for much from us, but I could sense that she felt defeated and was desperate for assistance. I entered her into Unite Us and referred her to a women's health clinic. I just got a note from the platform that the clinic had contacted her and are helping her get emergency Medicaid, financial planning assistance, and parenting support. It brought me to tears to read that. This client had been weighing on my heart all week. We also successfully referred another client for financial assistance to a nonprofit dedicated to addressing health disparities that I didn't even know existed. Feeling hopeful," close quote. We have in mind to do a research study on the effect of this closed loop notification on case manager well-being. Our hypothesis is that case managers who use the Unite Us platform will experience increased job satisfaction and less burnout related to knowing the outcomes of the referrals. The Unite Us has incredible data. One example of which is their health equity dashboard, where we can look at race and place-based inequities. This dashboard can be filtered by race, ethnicity, gender, and age group to identify missed opportunities. Using this information, the community can determine where to allocate resources, build partnerships, or come up with innovative solutions to address barriers. The platform is free to nonprofits who sign a business associate agreement, and through that agreement are held to high standards, including their timely action on referrals and in keeping the platform up to date with their latest program information. Most agencies are anxious to join the free network, where all other agencies can see their programs, where they can both receive and send referrals, and where they have access to their own data. At the bottom of the slide, you can see a quote from one of our fabulous case managers, Nicholas King. Quote, "I enjoy having the shared accountability between sender and receiver of the resource referrals. This can only benefit our patients," close quote. So these are a few of the other healthcare systems and government agencies that are using Unite Us across the country. You can see there are some major organizations here. Locally, the impact of using Unite Us has been significant. It launched in this area in September of 2020, so that's just slightly over a year and a half. And in that time, 5,000 referrals have been sent. I pulled this data on April 11th and was surprised to see it was bang on 5,000. So if I pulled it again this morning, it would certainly be over that. Currently, there are 144 organizations in the network supporting 232 programs. And since this time, over 2,500 families have been helped through the platform. Again, locally, these are just some of those 144 agencies on Unite Us. I've got a couple of slides here just to show you the return on investment for using Unite Us to address social determinants of health. This one shows results from Utah's largest health plan and health system, showing a 34.2% decrease in emergency department utilization for patients involved with the network powered by Unite Us. And this slide is an example of how the Unite Us data can help inform the work. It's well known and not a stretch to conclude that food insecurity results in higher healthcare costs. This is due to food insecurity being associated with higher rates of chronic diseases such as diabetes and hypertension, heart disease, and mental illness. On the left side of this slide is research from Feeding America in 2019. In Sarasota County alone, they estimate that 40,000 adults are food insecure, resulting in over $72 million in additional healthcare costs. They suggest that through partnership and collaboration between health and food service providers, addressing this need could lead to improved community health and financial benefit. Now, keeping that in mind, look at the right-hand side of this screen. This is the Unite Us data on food referrals sent. There are 846 clients served that we've been connecting with food agencies in the last year and a half. And thinking about that Feeding America prediction, that could translate into huge improvements for community health and healthcare savings. We conducted a survey among the staff at Sarasota Memorial that were using Unite Us and found the following. Using Unite Us reduced their time spent searching for services by 81%. It went from 2.7 hours per week to just about a half an hour per week. Additionally, it reduced the time spent sending referrals by more than 60%. It went from 2.95 hours per week to 1.15 hours. It also improved the discharge process. 60% of respondents agreed that using Unite Us improved the discharge process frequently or always. And the other 40% of respondents felt it improved the process at least half the time. And 80% felt confident that families always or frequently get connected with services. And the other 20% felt confident of that at least half of the time. At Sarasota Memorial, Unite Us has given us the confidence to comprehensively assess social and behavioral health needs in two places, in our post-discharge follow-up calls and the emergency care center. Having the Unite Us platform at our fingertips has allowed us to expand the work to include comprehensive assessments of social determinant of health needs and more effectively contribute to the vision of there being no wrong door for families in our region. We don't receive any reimbursement for it, but we feel we have an obligation and the opportunity to help pregnant and postpartum women connect with community agencies who have so many wonderful services that can help mothers and children get on the best trajectory for their lives. At SMH, more than 50% of babies are born into low income or poverty-stricken families. So many of these babies are starting their lives at an immense disadvantage. So first, to tell you a little bit about our post-discharge follow-up calls. We have for many years provided follow-up calls to all discharged families from Women's and Children's Services. Now, because we have the Unite Us as a tool, we are able to expand the scope of our follow-up calls to provide a more comprehensive assessment of mothers' well-being. We've found so many mothers that admit to needing services that they didn't recognize they needed at the hospital. We have been able to connect so many moms to all kinds of services, including food, continued social service case management, as well as therapy services. One particular case comes to mind. With our follow-up call service, we make 3 attempts over a few days to contact a mom after discharge. And in this particular case, on our 3rd and last attempt, by the grace of God, this mother answered the phone. This mom was struggling. Both her own parents had passed away last year, and now she was facing Christmas with her new baby without them. She was alone in the house. During the conversation, the nurse was able to gain the mother's trust, and she allowed her to make a referral to counseling service to help her with her difficult life transitions. As the nurse continued making her assessment, the mother admitted that she had been experiencing headaches since being discharged from home with her new baby. She had been advised to take her blood pressure every day and was taking prescription blood pressure medication as well. Her blood pressure the day before, she said, was 178/110, which she knew from her OB was high, but in her sadness, she didn't want to bother anyone about it. The nurse was able to gain the mother's confidence and understanding that she needed to get help right away. And not long afterwards, the mother was admitted to our intensive care unit. Without having the Unite Us platform and the subsequent expanded post-discharge follow-up calls, there would have very likely been another death in that family. Now, about the changes we made in the OB Emergency Care Center. There was strong collaboration needed on this project among women's and children's nursing, SMH case management, and SMH IT to build new assessments in the electronic health record and automatic triggers for case management consults. We rolled it out at both campuses in mid-January of this year. The social determinants of health needs of this population of women coming in for care in our OB emergency care center had not been addressed by us before, so we didn't know exactly what to expect. But we have had some significant finds. On the very first day, we were able to refer 3 women to community agencies. One woman was particularly troubled, and our case manager sent 7 referrals for her, including individual therapy, childcare, and housing. In less than 24 hours, we were able to see on the platform that 2 agencies had already accepted her for services. Another significant situation was identified more recently. A woman who was quiet and unassuming, and had we not been asking, would likely have not been identified as having needs, was found to have not only 1 plan to kill herself, but 3. It's stories like these that confirm to us that we're doing the right thing and makes us think of the potential for tremendous improvement and well-being of those most in need in our community if all organizations committed to standardizing the assessment of social determinants of health needs of their clients and referred them using the secure, efficient, and effective Unite Us platform. We've got the solution, so now let's just use it. This is a quote from Terry Hansen, the president and CEO of the Charles and Marjorie Barancik Foundation. And she said, "Raising a baby is hard, even for the most well-connected families. The system, Unite Us, provides an equitable platform for all babies to receive fair and just delivery of support. This is the biggest game changer to human services I have seen since arriving on the Gulf Coast." So it costs a lot to do nothing. So let's keep working together to ensure our health and social service agencies are never a wrong door for families in need. If you are not already doing so, please consider standardizing social determinants of health assessment in your agency's workflow and refer people as needed. This way, huge numbers of families across our region could be lifted up to happier, healthier, and more secure lives. Thank you.
Thank you, Mary and Dr. Hill. Anybody have any questions? That was extremely informative. And if you haven't been sold on the power of Unite Us, I don't think you're paying attention. That was amazing. And those stories are incredible and show the power of access to resources. Anybody have any questions? Otherwise, we're going to move on in the agenda. Lots of praise in the comments. Mary and Dr. Hill, I hope you're seeing those. Okay. Next.
Thank you.
Yes, next, speaking of Unite Us, we're going to have Stephanie tell us more about what we're able to see in our data. And I'm scrolling here and I knew I would get too much in the chat to find what her official title is. I'm getting there. There we go. Stephanie Harris, Senior Community Engagement Manager for Unite Us. Many of you know Stephanie, and for those who don't know her, she will come by your office and have coffee with you anytime and teach you everything you need to know about First 1000 Days. But before you start, Stephanie, we have a question. Looks like Catherine has a question. Catherine, your hand is up, but maybe that was a error. Catherine Matei. Okay. I think we'll move on. Catherine, if you have a question, can you just send it to me in the chat, please? I'll make sure we get to it. Okay, Stephanie, it's all you.
Great. Thank you so much, Cameron. And I do want to thank Sarasota Memorial Hospital and the Bransnick Foundation. And of course, First 1000 Days for bringing us together today. I think this is amazing. And everything that was just shared was very, very motivational, to say the least. And I know that all of you taking the time today for this call is very, very precious. So we're grateful that you did take the time for this call. Every time I'm on a call with Chelsea, Mary, and Dr. Hill, it's inspirational. So I'm grateful. So I just want to lift up some more data that I know Mary did an excellent job framing out some of the data and overview over the last more like a year and a half. This data is very specific to the last year and really just brings the 4 counties of the First 1000 Days Suncoast initiative together, which is great because we have been connecting and expanding throughout this region over the last year and a half. And over that last year, over 3,000 referrals sent, 1,900 clients connected or served, and over 2,000 cases. And then we are able to see those resolutions, which I think is a huge, huge insight to understanding the journey of your client. Most of you, when I do speak to you and try to understand how you're currently connecting and serving your clients, this is one of the measurements that is most helpful, I think, because as a former service provider myself, it's super helpful to understand the journey of our client before they walk in your door and then even after they leave and you're trying to continue to provide them that service. If there's anything we learned from Dr. Hill's presentation of the social determinants of health, is how critical it is to understand the full journey of a client and holistically connecting them to care. It's more than how you're able to help them today, but what happens next is super critical. And then one of the data pieces that I really thought was important to lift up is the over 4,000 service episodes provided to client. That example was really lifted up in Mary's reference to the woman that needed 7 referrals. That's 7 different service episodes. So being able to track and understand that client's journey with each leg of her journey of care is super, super critical. And the fact that through these 4 counties over the last year, April to April, that over 4,000 service episodes were resolved is super powerful because that's connecting people directly to the service they need in a very quick amount of time, which I think is very powerful. So here is some overview of services referred, top services referred, and then those that are still needed. So individual family support, specifically social service case management, is probably the #1 referral that is sent through the platform. Food assistance is right there on the tails, and as well as education, specifically childhood education. And then clothing and household goods is high on the list, as well as mental behavioral health services. So all of those services, if you provide those services, you're not yet on the platform, let's definitely have a conversation because we know these are services that are needed and there's more need than there are providers. And we all know that. Then as far as top services that are still needed on the platform, legal services is high on the list, utilities assistance, whether that's connection support, just help with that process, as well as payment. Some that are running behind on their payment may need that financial assistance. Housing and shelter needs, we all know we need more beds in our communities. There is a need to connect these clients to that care. Mental behavioral health services, the need is just so great right now. We need as many providers that are in that mental behavioral health space on the platform as possible. And then education, much like the early childhood education as the top services referred, we need to make sure we have those providers on the platform. That is becoming a very, very high need. And as we're going into summer and then coming into a new school year, I think it's going to become more critical. So if you provide any of those services and not yet on the platform, please connect with myself or Elena. Here are the next steps. Elena Jimenez is our new community engagement manager here in the Southwest region. She is on the call. I think you've seen her in the chat, and we are happy to come connect with you face to face, learn more about your organization. If you're already on the platform, we can reconnect, make sure that the Unitas platform is working for you. If not, we can find out why. It typically is a workflow conversation, and we're able to solve a lot of problems when we meet one-on-one to walk through that. You'll submit that partner registration form, which gives you access to Unitas and all the fabulous data that comes with that. We'll schedule training, some pretty in-depth training, and then hope one day you become a champion yourself and you're encouraging your partners to join as well.
Stephanie, sorry to interrupt. Jennifer's got a question.
Sure.
Hi, Stephanie, Jennifer Sexton, United Way of Charlotte County.
Hi, how are you?
I'm good. I had a question. You listed one of your top services needed was the utilities, and we fund Season of Sharing, but we're not the service provider. We're the admin side. So
Yes.
would it need to be the individual case management teams that are listed in Unite Us for them to be able to be referred to offer the Season of Sharing funds?
Yeah, that would be the preference. I mean, it could be you could receive it and then you send it to them, but in order for it to be tracked and it to be beneficial for everybody to have access to that data, it would make the most sense for that specific case manager of that agency to be on the platform.
All right, well, I'll ask one other question then, and if you want to just email me later, because you may not know off the top of your head, but are any of our case management agencies already in the Unite Us platform at this point? And again,
Yeah,
if you don't know, just
not as many as they should. So we
Okay.
can definitely connect after.
all right, thank you.
Sure.
Catherine, are you still with your hand up? Okay, we'll circle back.
No, that's great. Thank you all very much for your time. This is our contact information. Take a picture and then
I'm
we are available.
unmuted now. I sent a picture.
Oh,
I
shoot.
sent a question and it was just, who can you contact at Unite Us to get help for, let's just say a pregnant woman who needs health care?
Yes, we can connect with you to walk through. If you're already on the Unite Us platform, we can connect with you to show you how you can find the appropriate provider for that need.
How do you get on the Unite Us platform?
Just take a picture of this slide and you can email Elena or myself and we can connect with you to make sure you have attended one of our presentations, understand the Unite Us workflow, how Unite Us can support your organization, and then we'll connect one-on-one with you as well.
Stephanie, I
Catherine-
just wanted to jump in really quick. I wanted to say, if you have someone that needs support in navigating those services right now, and it's not something that you're able to do yourself or within your organization, you can send an email. I'll put our information in the chat to First 1000 Days, or you can call us and we can help that individual, someone from our team.
Okay, thank you very much for
You're
your
welcome.
help.
Yeah, and I do want to give a shout out to Tina and Sienna and Paige and all of our Sarasota Memorial First 1000 Days people, because they are excellent at helping navigate care for the community members in the region. I'm always blown away by the stories that I hear from some of that engagement. So I thank you all very much. But thank you very much.
Oh, is that the end of your? Stephanie, usually have more to say. I'm waiting for more.
I was very, brief to the point. Mary kind of stole the show there. I think I agree with your initial statement. I think she covered all the bases and she really helped, I hope everyone can understand the takeaway from the perspective of the hospital and partners that are on the call. I know many of you that are on the call are already partners of Unite Us, and we're grateful to continue to build that relationship. So if you do have questions, let me know. And I can also connect you with another fellow partner that's already been leveraging Unite Us in the region. Sometimes it is helpful to hear from a peer on how they're leveraging Unite Us. And I feel like Mary did that extremely well. So please don't hesitate to reach out to us so we can figure out the best way for Unite Us to support your amazing work.
And just to add on to what Stephanie was saying, if you saw those gaps, the list of the gaps, legal being one of them, and you have an idea of an organization that could really assist in that space, please let Stephanie and her team know, or somebody at that First 1000 Days at smh.com address know too. And Chelsea, I think I'm kicking it back to you, correct?
Yes. Well, and I wanted to address, there's a few questions in the chat about different languages and the language barrier. And really, Unite Us, there's two ways that people can enter into the system. One is an assistance request. So if they are out in the community and they have difficulty navigating resources and they don't know where to start, then they can fill out an assistance request form. There is one on the Unite Us page or Unite Florida page, but there is also one on the First 1000 Days Suncoast page. And really that's specifically for pregnant individuals or families with young children. The second way, which is the most preferred way, is that agencies are helping individuals get into the Unite Us platform for referrals. So ideally we want all of the different social service, mental health, and healthcare organizations, screening for these social determinant of health needs, and then connecting these families with resources. And this is really to take the burden off the families so that they don't have to navigate those services themselves. So they're not overwhelmed with different flyers or different contact information. So we're the ones that are helping them get connected with those services. So those are two ways. So when you have the language barrier, if someone's helping that individual, we hope that they're using a translation line or they have someone within their own agency that's able to speak that language. And then I will say that we have someone on the first 1,000 days team who is bilingual, who can speak Spanish. So if you need someone in your organization, if you need to help an individual and you do not have someone who speaks Spanish, that is a service that we can offer for first 1,000 days to help them. And then I just wanted to quickly see if there were any other questions because we're running ahead of time. Oh, good. I'm glad I was able to answer that question. I really just want to thank everyone here today. We're not done. We have some breakout groups that we welcome you to be a part of and participate. But I want to thank everyone on this call for joining us today. I know it was a holiday weekend for many, and we just want to thank everyone for participating in the initiative. We wouldn't be here without all of you. And it's really critical that we continue to work together to identify those gaps in services and really come up with ways to address the needs of families in our community. I did want to say that we have our full partner annual report that is coming out. I will be sending a follow-up email within the next week. Feel free to read it. We also have an abbreviated version, which is shorter, that goes along with it, our executive summary. And I'm also in the process of working on an 18-month Unite Us report, specifically looking at Sarasota County since we started and implemented it here. And we look forward to sharing that with our partners. And with that, I'm going to go ahead and open up the breakouts. We have 4 different ones that are available. One is what is Unite Us? This is for people who want to learn more. They want to learn how they can be a part of the network. Maybe they just have some basic questions that they need addressed before they join. The second one is I'm on Unite Us. Now what? Maybe your organization is already signed up for Unite Us. You're hesitant on how to get started, or you've already been receiving referrals, but now you want to send them, vice versa. And then we are going to have someone from the Unite Us team that's discussing and leading that group. Then we have another one, which is how to leverage the data on the Unite Us platform. And that's really where people who have been using the platform, or even if you're not, you want to learn the data capabilities, I highly recommend attending that. That will be with Stephanie Harris and Nina. And then the fourth one will be with Mary O'Connor and Dr. Hill talking about how to implement screening for social determinant of health needs within your agency, maybe coming up with a workflow. So I'm going to go ahead and put those up. So please feel free to choose your breakout and you will leave from that room. And again, I just wanted to thank you for your participation today, and we look forward to working with all of you in the future. And thank you to Cameron for your leadership. Dr. Hodgins, we really appreciate you as the steering committee member of First 1,000 Days and our chair. Your leadership has been really critical in what we've been able to move forward.
Thank you, Chelsea.
Chelsea, can I mention the summit next week with this audience?
Sure.
Thank you. Many of you have already heard that Healthy Start will be having its 4th annual summit next week. It's at the Carlisle Hotel. We'll be talking about substance abuse and mental health during COVID and this period of time. So if you need more information about it, you can go to the Healthy Start webpage or give them a call. Thank you.
Thank you.
I have one quick question. If anybody on here is from Manatee County and knows if the children's back to school fair is going to happen again this year, could you let Chelsea or me or somebody know? We were interested in having a booth there. But I tried to connect with Commissioner Whitmore last week and she said that she was going to find out for me, but I haven't heard back. But you know, we know everybody's calendars fills up and we'd like to get that on the calendar if that's going to happen. Thank you. Okay, Chelsea, I think the rooms, is that, oh, we can join one now, okay.
Yes, feel free to join the breakout room that you're interested in. Or you can stay with me.
I'm sorry, and how do we see the breakout rooms?
So it should pop up on your screen here. I'm actually I've sent you.
Thank you. Excellent, great, thanks.
Does everyone else see them?
Hey Chelsea, it's Nina. Can you send them to me as well? Because they didn't
Yeah.
pop up on my screen. Thank you.
Yeah, you're welcome. Anyone having trouble with the pop-outs, I can send you to whichever one you're interested in. Hi, Linda. Do you want to go to the data or the social determinant of health? Okay. On here. There we go. All right. Anyone else want to go? Let's see.
Could you repeat again the two rooms that I can choose?
Yes, of course. So the first one is what is Unite Us? If you just want to learn more about the Unite Us platform. The second one is I signed up, now what? So you're using it within your organization, but maybe you have some questions. The third is how do I leverage the data? So they'll just dive into what kind of data you can pull from the Unite Us platform. And the fourth one is how you can implement screening for social determinants of health in your organization.
I would like to be in the first one, how we can enroll our organization.
Sure.
I'm Esperanza Gamboa, MCR Health, yes. And we cover Manatee, Sarasota, and DeSoto County.
Okay, awesome. I'll send you over there.
Thank you.
You're welcome.
And can you send me to the same places as Tony Jeffries?
You got it. So you want to learn how to join? Is that what you're wanting to know?
Yeah, learn more about it. And yes.
Okay. All right.